So being a multiracial country, we have different races, we have different cultures, and we have different religions. So there are three different aspects that we need to talk about. Societal norms drive this discussion, and depends on who's discussing sexual health. Among men, even with men among themselves, they will never bring this up because the topic of sex is something that's a bit of pride, male ego.
Yep.
No man is going to tell his friend, "Oh, last night I couldn't get it up." It's not. It's sniggers. It's a joke, and it's laugh. But that's the problem that we have in our society, and that's at one aspect. And then we have another complete aspect with the younger children, where they are exposed to so much things online, but nobody tells them what's right or wrong. Nobody tells them to understand their own bodies and hygiene and health and everything else. So it is definitely a problem. But I do see changes. We're willing to have the talk. More and more topics, more and more podcasts like this, radio shows, TV shows, where topics have been brought up. The question is, to get that information out there and to get the right information out there. But it is difficult, even with doctors and the patients, just for me to ask the patient, he has to look left, he has to look right. He's like, can your nurse leave the room?
Yeah.
It's a very embarrassing topic. But what we're trying to tell you, it shouldn't be a topic. It should be something that we discuss because there's a lot of ramifications. Sexual health doesn't just affect the husband, it affects the wife, it affects the family, the children, the whole relationship, but who's he to discuss it with, and unfortunately, that's when people take shortcuts. When you don't want to have the discussion or you're afraid to have the discussion, you take the easy way out. You go on TikTok and you buy a supplement that you don't really need.